Top 19 Diabetes Doctor. Hi guys. Welcome to my channel. Before we get started, make sure to hit that like button. Also subscribe to my channel. Top 19 Diabetes Doctor. So make sure to watch the full video. 19 Primary Care Doctor who deals with general health issues. This is your person for routine care such as regular checkups, issues other than diabetes, and vaccinations. When it comes to diabetes, however, PCP plays a vital role as the central coordinator of your care, says Barrolos. This means that he or she will refer you to a specialist for the specific problem at hand. Follow up to make sure you have seen this person and understand the treatment you are receiving, and help you stick to your care plan. They should also keep a complete list of all medications, prescription and over-the-counter, and supplements they take. 18 An endocrinologist who helps manage blood sugar. This doctor treats diabetes and other disorders of the endocrine system, which is especially important if your PCP is not working for many people with diabetes. This doctor will help you control your blood sugar. They will determine if blood sugar-lowering medications are needed and determine which medications and dosages are right for you. As the American Medical Association points out, because many of these diseases, including diabetes, are lifelong, endocrinologists can maintain close, long-term relationships with patients. While this is an important physician on your team, be aware that a June 2020 article in the Journal of Clinical Endocrinology and Metabolism documents a shortage of practicing endocrinologists, which may lead to wait times excessive for appointments specializing in diabetes. Use the Society for Endocrinology's tool to locate by zip code and specialty ways to improve your sleep if you have diabetes. 17 Ask a pharmacist about your medications. This professional can help you understand your medications and how they work. They can also check for drug interactions, which is especially important if you're taking multiple medications prescribed by more than one doctor. According to a January 2017 review published in Integrated Pharmacy Research and Practice, pharmacists can play an important role in diabetes care and have been shown to reduce the number of hyperglycemic and hypoglycemic episodes, which not only benefits your health but also saves you money on your care too. 16 A registered dietitian nutritionist develops a diabetes-friendly diet. According to a consensus report published in the journal Diabetes Care in April 2019, good nutrition is an important part of diabetes management. It's about knowing what to eat and what to avoid, and how to eat your favorite foods while keeping your blood sugar in check. A registered dietitian nutritionist, RDN, can help you in addition to helping you achieve other health goals, such as losing weight or improving your blood pressure and cholesterol. Above all, they can help you try a specific diet, such as a ketogenic diet or intermittent fasting, safely. Ideally, you will work with an RDN that is also a CDCES. 15 Certified Diabetes Care and Education Specialists, CDCES, creating a healthy lifestyle. This certified healthcare professional will help you develop a diabetes management plan and implement lifestyle changes. CDCES typically spends more time with people with diabetes than PCPs. Appointments with CDCES typically last an hour, says Barrolos Target. Many CDCES professionals are also RDNs, which means they can work closely with you to develop healthy eating habits for successful diabetes management. Some CDCES certified professionals, such as Barrolos, have training in behavioral psychology, which is a specialty that offers additional benefits for patients. Working with a psychologist can help address some of the challenges that people with diabetes face, she explains. They also act as accountability partners. These professionals want to be your cheerleaders. They want you to succeed, Barrolos said. Diabetes educators are often employed by the hospital system or in private practice. Find one in your area through your PCP reference or using the Diabetes Care and Education Accreditation Council's locator tool. 14 Dentists who monitor gum health. Taking care of your teeth and gums is essential for everyone, especially if you have diabetes because, according to the American Dental Association, periodontal gum disease is a common complication Treating gum disease can also improve blood sugar control, according to the group. Talk to your dentist about how diabetes can affect your dental checkups. 13. Podiatrist for foot-related diabetes complications. This doctor specializes in leg and foot problems and will help you examine and manage any lower extremity complications. According to the American Podiatric Medical Association, complications of diabetes lead to more than 100,000. Seeing a podiatrist to monitor and treat any foot problems can reduce the risk of lower limb amputations each year of amputation by up to 85%, according to the organization Bonus. Barolo says some podiatrists also have CDCES certification. 12. Ophthalmologist prevention of eye disease caused by diabetes. Your ophthalmologist will help you maintain healthy vision and monitor you for any complications due to high or uncontrolled blood sugar, including diabetic retinopathy, diabetic macular edema, cataracts, and glaucoma, according to the American Academy of Ophthalmology. The Centers for Disease Control and Prevention, CDC, recommends annual dilated eye exams for people with diabetes. 11. An inner circle that promotes good habits. Let your loved ones know how healthy you are, in your comfort zone, and how they can help ease the burden of your diabetes diagnosis. Friends and family can relieve some of the stress of managing diabetes if they provide positive support, Barolo said. In other words, you are not alone. 10 support groups to share ideas about healthy living with diabetes. Support groups, most of which are now virtual, can connect you with people with diabetes, PWD, who understand the challenges, and they can offer tips and strategies to provide for healthy living. The Barolos especially like the Diabetes Sisters. The American Diabetes Association has an excellent community support channel that provides a helpful forum for people with type 1 or type 2 diabetes and their caregivers. 9. Dr. Chaitanya DC. Dr. Chaitanya is a famous consultant with experience of more than 6 years after finishing his MBBS and MD in internal medicine. His particular interest is in internal medicine and diabetology. His fields of expertise are diabetology, infection disease, metabolic diseases. 8. Dr. Sundararajan Sridhar. Dr. Sundararajan Sridhar is a famous endocrinologist and diabetologist, having experience of more than 35 years. 7. Dr. Rajendiran N. Dr. Rajendiran N. is a famous endocrinologist in Chennai. Now he is working as a senior diabetic consultant at Apollo Hospitals, Chennai. He has an experience of over 3 decades. His expertise in diabetic consulting, his special interest in the gestational diabetes type 1 diabetes type 2 diabetes. 6. Dr. Bhuchandran T.S. Dr. Bhuchandran T.S. is a famous endocrinologist in Chennai with the experience of 25 years. He is working as a consultant with the Department of Endocrinology at Apollo Greaves Road, Chennai. He is working in the field of diabetology and endocrinology since 2001 and in general medicine and medical rotation since 1990. 5. Dr. Satish Kumar S. Dr. Satish Kumar S. is an endocrinologist, diabetologist, neuroendocrinologist, and bariatric physician and has more than 24 years of experience. 4. Dr. P.G. Sundararaman. Brief profile. Dr. P.G. Sundararaman is a famous endocrinologist who has experience of more than 26 years. He has done MBBS, MD, and DM in the endocrinology specialty. 3. Dr. Jasjit Singh Wasir. Brief profile. Dr. Jasjit Singh Wasir is a famous endocrinologist who has practiced more over 20+ years. His specialties are weight management, obesity, for diabetes assessment of heart attack risk for diabetes patients, controlling and preventing heart attacks for diabetes patients. 2. Dr. Arun Bal. Dr. Arun Bal is a famous endocrinologist in India and has more than 42 years of experience in the field. He is actively involved in academics and clinical research and is a teacher for the Muse, Maharashtra University of Health Sciences, for the Fellowship in Diabetic Foot. 1. Dr. Anup Misra. Dr. N Mehrotra is a famous endocrinologist and diabetologist. He has more than 40 years of experience in his field. He has worked in many medical institutions as a member of the faculty at the Department of Endocrinology and Human Nutrition of the University of Texas Southwestern Medical Center Drive. Mehrotra was a fellow of the World Health Organization at the Department of Diabetes and Cardiovascular Risk of the Royal Free Hospital, UK. Along with that, he also has experience of moreover 30+ years in teaching, service, research, and other community health intervention programs. He has a lead investigator on body composition, like imaging of abdominal fat depots, liver and pancreatic fat in our country. What do you think of our video? Let me know in the comment section below. If you enjoyed this video, make sure to hit that like button. Also subscribe to our channel before you go.